In modern clinical psychology, the term God complex is not used as an official diagnostic term and is understood rather as an informal descriptive label applied to manifestations close to grandiose pathological narcissism. In the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, narcissistic personality disorder is characterized as a pervasive pattern of grandiosity, a need for admiration, and a lack of empathy. Its clinical picture includes, in particular, a belief in one's own uniqueness, fantasies of unlimited success, power, and superiority, a strong sense of entitlement, interpersonal exploitation, and arrogant behavior. In broader clinical practice, such manifestations are additionally described within the framework of pathological and, in some cases, malignant narcissism, as well as in the context of partial overlap with psychopathic traits. However, in a criminological and forensic psychological perspective, the main focus is not so much on diagnostic classification, but on how these corresponding personality traits manifest in the subject's motivation, behavioral strategies, and forms of committing violence. In this context, the expression God complex can be used only as an informal designation for a set of stable motivational and personality patterns in different types of offenders. First, these are power-assertive or power-control serial offenders, for whom the act of violence serves primarily as a way to assert control and dominance over the victim, rather than simply as a means of achieving immediate physical satisfaction. Second, these are the so-called angels of death, healthcare serial killers who use their professional environment to exercise power over the life and death of patients. Sources cite a hero complex, narcissistic grandiosity, and the pleasure of determining the moment of death as motives and characteristic signs of such crimes. Third, from the perspective of forensic psychology, such manifestations can be linked to instrumental predatory violence, in which another person loses their status as an independent subject and is perceived primarily as an object of control, manipulation, and the exercise of power. If we follow the logic of the model of Michael Stone, psychiatrist and professor of clinical psychiatry, the most pathological forms of such strivings are associated with a combination of narcissism and aggression, an effort not just to violate another person's boundaries, but to usurp symbolic power over their life, freedom, and human status.